Hello, and thank you for joining us for our live COVID-19 Q&A about the Omicron variant and vaccinations. Today, I'm joined by two of our infectious disease experts here at UI Healthcare, Dr. Dan Diekema and Dr. Pat Winokur. They will be answering your questions, so please submit them now and we'll answer as many as we can. Just a note before we begin, this broadcast is for informational purposes only. If you are feeling sick or are concerned about your health, please contact your primary care provider. Thank you for joining us today, Dr. Diekema and Dr. Winokur.
Thank you.
Thanks for having us.
All right, let's get started. Dr. Diekema, we'll start with you. So what are we currently seeing? What is the status of the pandemic in the US, Iowa, and more specifically here in Johnson County?
Yes, well, unfortunately, it's not good right now. In the US, we're seeing a record number of COVID-19 cases, higher than we've seen at any point in the pandemic. In fact, over 3 times higher than the case numbers we've seen ever before in the pandemic. Over 800,000 new cases reported per day in the United States on average. Now, the hospitalization numbers in the US have not gone up to that degree, but because of the sheer number of cases with this new Omicron variant, we have now exceeded the highest number of people hospitalized in the US with COVID-19, over 140,000 hospitalized in the US. The state of Iowa is also seeing record numbers of cases and is seeing increased numbers of individuals, unfortunately, hospitalized with COVID-19. And here in Johnson County, it's really remarkable, the number of cases that are being reported. I think the most recent numbers are about 240 cases per 100,000 population per day. And that is twice what we've ever seen before during the pandemic. So more cases than ever before in Johnson County. And we are now also starting to see some increased numbers of people hospitalized with COVID-19 as well. So we're definitely in the thick of this latest wave of the Omicron variant.
Thank you. We're going to jump to a few of the viewer questions. Janet asks, does COVID still spread outside in cold weather, such as when you're walking through a parking lot?
So I can answer that one. COVID-19 is spread through aerosols, and your risks are highest when you're closest to someone and they're coughing or speaking loudly, and you're in close contact for longer periods of time. Passing someone in the parking lot is lower risk. You're outside, there's more air movement. If you are immunocompromised and have a high risk of disease, I think even in those settings, it's worth being cautious, but that is much lower risk than being in a closed room close to someone for long periods of time.
Thank you. Dr. Winokur, how is the Omicron variant different from previous variants?
So this is, let me go back and start a little bit from scratch in the sense is, why do we even care about these variants? And there are a couple of reasons that we care about these variants. We care if they increase transmission from person to person. We care if they cause more severe disease. We care if these variants evade our vaccines or evade the treatment options we have. And we care if we can't diagnose them as readily because our tests don't work. The Omicron variant has more mutations than any of the previous variants we've seen before. And of some of those things that I just mentioned, we are seeing that the Omicron variant is more transmissible. It is pushing from person to person more quickly. Now, the good news is it looks like when you look at the science of this virus, that it likes to replicate more in the kind of nose and throat and less so in the lungs. So we are seeing that it's causing less severe disease. So that part's really good.
Thank you. And our next question again for you, Dr. Winokur. What does the data say about the importance of vaccines, specifically with regards to safety and effectiveness?
So the vaccines have been studied very carefully now, and I think there's two questions in that question. One is, in general, how safe are the vaccines? And we've now studied these vaccines for very close to 2 years, and people have found that these are some of the safest vaccines that we have in our armamentarium. We have very few severe side effects with these vaccines, and we are not seeing anything popping up now 2 years later after people have gotten these vaccines. So that's the really good news. And then the second question is, how good are these vaccines against Omicron? And Omicron, I told you, has more mutations than any of the previous variants we've seen. And we are seeing that the vaccines are not quite as good against the Omicron strain for preventing infection. But remember, I told you this variant likes to replicate more in the nose and throat than it does in the lungs. And one of the really good things that we are seeing with this vaccine is, even though we're seeing maybe breakthroughs more than we had hoped, we are seeing that this is preventing serious illness, and it is very effective at preventing people from coming into the hospital or ending up in the ICU. So these are very good vaccines still.
That's good news to hear. Why are some people who are fully vaccinated, even those who have had a booster shot, still getting infected with COVID-19?
I think it gets to that question that these vaccines, because of the mutations that we're seeing in the virus, don't create antibodies that are quite as perfect for this variant as they did against the original Wuhan strain, or even some of the UK variants and South African variants, all sorts of different variants. But really what's happening, and we're seeing this with people who've been infected, we're seeing this with people who've been vaccinated, is over time, the antibody titers are dropping. And it's as that drop in antibody titers occurs that we're seeing people breaking through. So a lot of it is when you got vaccinated. And so the other thing that I would like to really point out is, even though after the first 2 doses, what we call the primary series of the vaccine, we see a waning of the antibody titers and more breakthroughs, when you give the booster, the antibody numbers skyrocket, and the protection is really still very good. So that booster is really important.
Thank you, Dr. Whitaker. Dr. Diekema, some of the symptoms of COVID-19 are similar to the flu or the common cold. When is it recommended that people get a COVID-19 test?
Yes, very good question. The symptoms of COVID-19 can be quite variable from person to person. So any sort of symptom that you would normally think of as being flu-like or cold-like symptoms, sore throat, sinus congestion, cough, headache, fever, extreme fatigue, loss of taste and smell, all of those are indications that you could have COVID-19 and you should seek a test. The other major time to seek testing or to do a home test, if you have access to them, is after an exposure to someone who you know had COVID-19 or was infectious at the time of your exposure. That could be someone you live with, or someone that you were within 6 feet of for more than 15 minutes outside of your household. If that person subsequently was diagnosed with COVID-19, then it's recommended that you get a test on the 5th day after that exposure while you're monitoring your symptoms. And if you're fully vaccinated and boosted, you can still go out of your house and while wearing a mask and keeping other safety precautions in place. If you aren't fully vaccinated or boosted, public health authorities recommend that you do stay at home for at least 5 days in quarantine until you get that test. So little bit of a complicated answer, but basically when you have those symptoms that I mentioned, or if you're exposed to someone who's known to have COVID, that's when you need to seek testing.
And a follow-up on the testing, there are many types of tests available. Could you explain the options and how they differ?
Yeah, so the three major types of tests are serology, which is testing for antibodies against the virus that are present in your blood. The second type of test is an antigen test, and that tests for actual sort of proteins from the virus from a sample, usually taken from your nose or nasopharynx. And then the third type of test is a PCR test that looks at the genetic material from the virus. And so going quickly in order, the serologic testing is not particularly helpful in terms of telling you if you're actively infected. It's used mostly for epidemiologic studies to tell in a population how many people have been exposed to the virus. And it can also be used to check whether there's evidence of antibodies induced from the vaccine. So putting the serology aside, the two major types are antigen tests, and that's where most of your home tests are. Those are antigen tests. Those are most likely to be positive or most sensitive when you have high levels of virus in your nose and throat. So those are also happen to be the times when you're most likely to transmit the virus. So the antigen test can be very useful when you're having active symptoms or shedding a lot of virus. However, they're not as sensitive as the PCR tests. Those are the tests that are mostly done in hospital laboratories, and those are the sort of gold standard tests for diagnosing COVID-19. The one downside to the PCR tests is that they're so sensitive that they can sometimes detect genetic material from the virus that's being shed from your lungs and throat and nose for weeks and weeks after your infection. So all of these tests, need to be interpreted with caution. But the antigen tests are the ones that are most commonly used for home use. But I just want to caution again that if you take an antigen test because you have symptoms of COVID and it's negative, you should still seek out a PCR test because, as I said, the PCR tests are the most sensitive tests.
Thank you, Dr. Diekema. Another one for you. What other safety precautions should Iowans be taking right now? And does vaccination status impact any of those decisions?
Yeah, vaccination status does impact some of the recommendations that public health officials make about isolation and quarantine. And I should mention, particularly for those who are here in Johnson County, Iowa, the Johnson County Public Health website just has a lot of really useful practical information about many of these issues. But what should Iowans be doing right now? I think the number one thing is to get vaccinated if you haven't been vaccinated and get boosted if you are eligible for a booster. I can't emphasize enough something that Dr. Winokur said, which is the booster dose is particularly important to protect against the Omicron variant. We have a lot of good data now from other parts of the world where Omicron hit before it hit the United States. And it really shows that booster dose is what really ramps up your protection, not just against any infection, but most importantly, against getting severe disease due to Omicron. So vaccination is number one. Number two, I would say, is to up your mask game, so to speak. If you are wearing still, a gaiter or a cloth mask that's a single layer or something like that, you need to try to upgrade that. Medical grade masks are increasingly available now. And I know there's plans for the federal government to send medical grade masks out for general use. I would recommend those over a cloth mask. The most important thing, of course, is that whatever mask you use fits snugly over both your mouth and nose. And the mask is there to not only protect you, but also to protect those around you from aerosols that you might produce while unknowingly shedding the SARS-CoV-2 virus.
Thank you. With Omicron so transmissible, some have assumed everyone will get the virus eventually and question whether safety precautions are worth it. What are the risks of that approach?
Yeah. Well, I can start and then pass it along to Dr. Winokur. I totally understand this perspective and why people are asking this question, simply because we're seeing so many cases of COVID-19 during this Omicron surge. But I'll say a few things. One is getting infected with Omicron is not inevitable. Now, over time, most of us will be exposed to the SARS-CoV-2 virus if we haven't yet, but you really want to be fully vaccinated and boosted when you encounter this virus. It could still protect you from any infection, and it will definitely protect you from severe disease. So not a good idea to go out with no regard to being exposed to the virus. The second point I would make is everyone by now has heard about long COVID. And we know that infections are not always mild and self-limited, even with Omicron. Some people do get hospitalized, some people do get severely ill, and some people have symptoms that persist for long periods of time. You really want to avoid that if possible. And then lastly, I would say that for those who remember very early on, it seems forever ago now, early in the pandemic, we talked about crushing the curve. And what we meant there was if you have these very high peaks in infection, even with a variant that is less likely to lead to hospitalization, those really high numbers will still have the potential to overwhelm hospitals, because even if only 0.5% of the people who are infected require hospitalization, if you have 300 or 400% more cases, that's a lot of people who need hospitalization. So by taking these precautions, we can lower that peak and what we call crush the curve, and in that way also preserve the capacity of our healthcare system so that we can provide excellent care both to those who have COVID-19 and to those who have other life-threatening illnesses.
I want to chime in just a little bit here because, the concept of, let's just go ahead and get the disease. We have a lot of data now that we can see the side effects of getting disease, and we can see side effects from the vaccine. And even for some of those more severe things that we saw in the, young teenage men, where they got some inflammation of the heart muscle, people forget that myocarditis is 5 times more likely when you get COVID infection than it is with the vaccine. And when you look at the long hauler symptoms that Dan referred to, we know that having the vaccine reduces your incidence of long hauler symptoms over 50%. So the vaccine is really important in modifying the severity of disease, and that's true for Omicron, it's true for Delta, it's true for all the variants we've seen. And there's a really good data set now that shows that getting the infection often causes some of these rare, really serious complications, and the numbers far exceed what any complications have been with the vaccine.
Thank you both for your input on that question. We're going to, if you're just joining us, we're here with UI Healthcare infectious disease specialist, Dr. Dan Diekema and Dr. Pat Winokur, discussing the Omicron variant and vaccinations. Let's take a look at some of the questions submitted by our viewers. Heidi asks, what is the progression of the Omicron variant? How long does it usually last?
So this is a good question because, as we've talked about, the disease that we're seeing in people that are infected with Omicron is a little bit less severe than what we've seen with Delta. And there's data that's come out of Kaiser Permanente, a US very big healthcare system. And even for those who got hospitalized, not a single person with Omicron was ventilated. We also saw that they had a much shorter hospitalization time, 3 days, and shorter than for those who had gotten Delta. I see a lot of people that have been in our clinical trials, and so I get a chance to, tabulate their symptoms and how long they last. Most of them feel much better after a few days, and we're not seeing some of those late side effects that we saw with some of the previous variants. So I would say you don't feel good. People feel like they have the flu, not always, but oftentimes, but it usually improves in 3-4 days.
Yeah, I agree with everything that Dr. Winokur just said, and thinking about it more, particularly those who are fully vaccinated and boosted, more like a flu-like illness. It's no fun, and some people feel really quite miserable when they have COVID-19, even from the Omicron variant. But after a few days, in general, symptoms will improve. And then I would just add, and this I think answers another viewer question, and that is that some infections come with no symptoms at all or very few symptoms. And this in general is more, well, it's definitely more likely in those who have immunity to the virus that can prevent more severe or symptomatic illness. Basically, the immune system and the antibodies that are present from vaccination quickly quell the viral infection, but there's a short period of time during which you are shedding the virus and can transmit it to other people. So one of the reasons this virus, over the last now, unfortunately, 2 years has been so difficult to contain is because of this phenomenon that people can spread the virus to other people before their symptoms start and even during a time when they don't have any symptoms at all.
Thank you, Dr. Dikema. Kathy asks, once Omicron settles down, will the danger of the virus end as well?
I think that's a really good question. Every time we do these talks, we know that the future is in the future and we're making our best guesses. I think we will continue to see problems with variants for a while. And a lot of that is because the whole world needs to get vaccinated and immune. And we don't have enough vaccines that are in some of the more developing countries. So I think we're going to see variants occurring, and we will be improving the herd immunity. Every time someone has a vaccine or gets infected, you're building immunity in the population. But we have a long way to go still, just because of those the breadth of this pandemic and what we need to do around the world.
Thank you, Dr. Winokur. Jane is wondering what specific responses are most effective when communicating the importance of vaccines to those who are unvaccinated.
This is a hard one. I think in general, people like to hear information from their own physicians, and making sure that we're doing a good job of keeping the information flowing for all the practitioners out in the state so that they can give the best information. That's important. I think not blaming people. We're trying to do the best we can with giving accurate information that we have for today. We will continue to learn about this pandemic, and you will see changes and recommendations as we learn or as new variants come about. So I hope people realize that we are always in medicine learning every day. And this is particularly true when you have a pandemic and we are developing new strains and other things. And so we will keep trying to give the best information we can. And I think people who talk to their own family members often are very effective. Sharing your experiences with the vaccine, information that you've heard from reliable sources, those are helpful.
Yep, I agree completely, and I think sometimes also appealing to the reason that one gets vaccinated is not simply to protect oneself, but also to protect those around you and your loved ones, and that your decision is not a purely individual decision. It's a decision that impacts other people as well. And then, as Dr. Winokur mentioned, people need to hear these messages from sources that they trust, and they also, if possible, need to understand that a lot of sources that may appear authoritative and a lot of sources that they may go to for information contain a lot of misinformation. And I don't know, I think this is on Facebook, right? And Facebook, I think, is one of the platforms that has been notoriously the worst in terms of allowing misinformation to spread. So I think as a society, we also have some things to do to try to reduce the spread of misinformation that's dangerous, that actually leads to people being hospitalized and dying.
Definitely some great input from both of you on that one. Peter asks about side effects of the vaccine, specifically if those are needing treatment and how those people are treated.
Yeah, so the vaccines have proven to be extraordinarily safe, and there are very few things that have occurred with the vaccine that require any therapy at all. It's very common, especially with the primary series, even some with the boosters, that they'll have a day or two where they might have a temperature, feeling achy, and that's just the vaccine is working. It's stimulating your immune system and doing what it's supposed to do. Tylenol, ibuprofen, those are really helpful for those symptoms. But we have not seen long-term side effects, and we have not seen anything that is requiring very specific therapy. Even those most severe, very rare cases of myocarditis that are more common, as I said, in young men, most of those go away on their own with no therapies at all. And that is not true for the myocarditis that we've seen with infection. Sometimes those are requiring therapy.
Yeah, I'll just add that we carefully track at University of Iowa hospitals and clinics the number of people who are in the hospital being treated for COVID-19, and making sure that we have the capacity to continue to provide that care for both them and for everyone else who needs care. We don't track. The reason we don't track the number of people hospitalized for vaccine side effects is because that number would be zero virtually every single day. We're just not seeing people in the hospital related to vaccine side effects. As Dr. Winokur said, these are generally mild, self-limited, and can be treated symptomatically, just do not require people to come into the hospital. And then I would add finally that of those that are in the hospital with COVID-19, the vast majority are unvaccinated.
Thank you. Stephanie is asking about tests that have come back positive 90 days after the first positive test. She is wondering if there is any way to tell if this is a new variant or possibly a dead virus from the last infection. And does this type of test matter?
Yeah, this is a really good question that gets back to what we discussed earlier about the type of test. There is that Achilles heel of the PCR tests, or the tests that are done in most hospitals to diagnose COVID-19. They can be intermittently positive at least, up to 90 days after an episode of COVID-19. And most of the time, those positive tests are detecting remnants of the genetic material of the virus that's being shed. However, it is possible to get reinfected within that 90-day window. So even though we don't generally test with PCR anyone who doesn't have symptoms, like say they were exposed, but they're not having symptoms and they were told to test at 5 days, we generally will not do a PCR test in that case because of the concern about these misleading positive results. But if you have symptoms of COVID-19, even if you're within that 90-day window, we do suggest getting tested because there are, uncommonly, but there can be reinfections even during that window of time. It's just very unusual. And then finally, there's unfortunately no great way to tell if the test is finding remnants of genetic material from dead virus versus active virus. There are some laboratory parameters behind the scenes that we can look at that can be helpful, but in general, it's not a particularly easy way to make that distinction. And then the last thing I'll add, and I'm sorry to be a little long-winded here, the antigen tests don't seem to suffer from the same problem of having intermittent positives for weeks after an episode. Usually those antigen tests become negative within 7 to 10 days. And so a positive antigen test with symptoms that occurs, 2-3 months later should definitely be taken seriously as an indication that one might have COVID-19.
Thank you, Dr. Diekema. If you're just joining us, we're here with UI Healthcare infectious disease specialist, Dr. Dan Diekema and Dr. Pat Winokur, and they're answering questions about COVID-19, including the Omicron variant. Please comment with your questions and we'll answer as many as we can. Should people who previously had COVID-19 get the COVID-19 vaccine and a booster shot if eligible?
So the answer is yes. So one of the things that we know with your immune system is repeated exposure through multiple doses of vaccine, or even you start with the infection and then you come and get the vaccine, is your antibody titers get higher and higher typically with those repeat exposures. But not only are the numbers of antibodies higher, the quality of the antibodies, they become better able to bind to the virus. And what we see in people who have had natural infection who then get vaccinated, they develop much higher numbers of antibodies, and they also develop better antibodies. So we do recommend that they get vaccinated after having a natural infection. And just like the vaccine antibody titers, even if you got your antibodies after having a natural infection, those antibody numbers wane over time. And so you are not immune to reinfection forever. It's much better to then come back and 5 months or so later, after you've had the vaccine, even if you've had natural infection, get that booster.
Thank you, Dr. Winokur. And I know you've touched a little bit, on the reinfection. How likely is that reinfection after you've had COVID-19 and what other factors are involved?
That's a really difficult question to ask because a lot of it depends also on your adherence to all the things that we've been talking about, wearing masks, social distancing, trying to reduce your exposure. And so it's going to be really different for someone who is really adherent to all of those practices that we recommend to reduce your exposure. The data that Dan has talked about, I can kind of reiterate, talk about it, and then he can chime in, is right now in Johnson County, if you have an event, a social event with 10 people that are outside your family, you have a 40% chance of being exposed to COVID-19. And that's because there's a lot of COVID-19 circulating in Johnson County right now. So it's really important right now to flatten the curve, protect our healthcare workers, our workers in other essential jobs. It's important to protect yourself from COVID-19. Wear a mask right now, be more careful, fewer social events, and try and flatten that curve.
Yeah, I agree completely. And you know, to get back to that individual's question about the risk after infection of reinfection, the large studies that were done early in the pandemic showed that after a documented infection, for about the next 6 months or so, those individuals were up to tenfold less likely, you know, to get infected. In some of the studies, even more than that, than someone who hadn't been infected. So we expect that some of that protection remains. The things that have changed a little bit are we have a more transmissible variant now. We don't know if some of those numbers from earlier in the pandemic will hold up. And we also know that when someone has or that the duration of time after that 6 months, we know that reinfection, you know, risk increases. So it still is important to get vaccinated, even if it's right after you've had an infection. If you haven't been vaccinated, you shouldn't depend on the infection-induced immunity alone. You're eligible to be vaccinated as soon as you are no longer infectious and feel better and have recovered.
Thank you. What does the latest research say about the likelihood of long COVID based on your vaccination status? And does that change based on the variant you are infected with?
Yeah, so I mentioned this a little bit earlier. The data that I've seen that's tracked this very carefully is vaccine reduces the incidence of symptoms that last over 28 days. Those are some of the kind of brain fog, severe fatigue. It's reduced by 50% in those that have been vaccinated, yet break through and have an infection. So the vaccines are helpful in preventing long-term symptoms. They are not perfect. Remember, vaccines aren't perfect. Your immune system has to recognize the vaccine and make antibodies. And we have people who are immunocompromised who don't make a good immune response to the vaccines. And every once in a while, there's just someone's natural genetics or something that they don't respond to a particular vaccine. So it's still really helpful, and it reduces the long hauler symptoms.
Thank you, Dr. Winokur. Lots of myths have circulated about treatments for people who have COVID-19. What treatments have shown to be the most effective for patients hospitalized with COVID-19?
So a very good question. We've learned just an awful lot about treatment of patients who get severe COVID-19 and need to be hospitalized. And the most, effective medications tend surprisingly to be those medications that modify the immune response to the virus. It seems that for those individuals who get the sickest from COVID-19 and say need to be admitted to the intensive care unit, oftentimes that has to do with the kind of interplay between the virus and the immune system. So medications like steroids and then other types of medications, I won't mention, their specific names, but they target other parts of the immune system that we think are counterproductive and can cause disease to get worse. And those treatments now are, used quite routinely in patients who have to be hospitalized, and they've really helped reduce the death rate from COVID-19 substantially. And then I should also mention that we're seeing some really exciting developments on the outpatient side. So individuals who are at risk of having progression of COVID-19 can now have, and most of the viewers probably have heard about the monoclonal antibodies. Some of them have been taken off the table by Omicron because of Omicron's ability to evade those antibodies. But there is a monoclonal antibody that's still effective against Omicron. And then there are some oral therapies that can also be used now within 3 to 5 days of symptom onset that are highly effective at preventing hospitalization and severe outcomes. So, these are really, I think, promising. And along with the expansion of vaccination so that we have more population immunity, as Dr. Winokur said, where we hope to end up, even if, COVID-19 is with us for the foreseeable future, getting to a state where the illnesses that are caused by COVID-19 are milder and treatable and keep people out of the hospital. That's really, one of our near-term goals here.
And the only thing I'll say, though we're really happy that there's really one monoclonal now, one company's monoclonal antibody cocktail that's working the best with Omicron. And we have some of these new oral antiviral drugs. They're in really limited supply right now, and we can't get enough. And nobody in the country can get enough. The companies are trying to ramp up production as fast as they can. And so this is something that, again, prevention is much better than treatment because we just don't have the guarantee that we're going to have the right medications to treat the virus itself or prevent severe infections. We have lots of steroids. Those are pretty commonplace medications, not a problem. So once people are severely ill, we have medications, but preventing people from getting severely ill, though we would love to have more, and we're confident that these drugs work pretty well, we just don't have a great supply.
Thank you. So you both have mentioned a lot of information, guidance, and data related to COVID-19, the Omicron variant, and vaccinations. To recap your earlier comments, what are the most important things Iowans can do to help end this pandemic?
Well, I'll start, and I mentioned this before, but get vaccinated if you haven't been vaccinated, and get your booster shot if you're eligible. And then the next thing I think that's key is to mask when you're outside of your household in public, and think about the mask you're using, and think about options to up your mask game, so to speak, moving from a cloth mask to a medical grade mask, or wearing a cloth mask over a medical grade mask to get a better fit. If the KN95s are more comfortable for you, those are also highly, highly effective. So those are the two things that I think about first when I think about advice during the Omicron surge.
And remember, if you have family members who have a compromised immune system, they need to be protected as best as we can protect them. And that's by surrounding them with vaccinated people, maybe going to the grocery store for them so that they don't have to go out in public. It's time now to be a little bit more careful about social gatherings. The holidays sadly are over. We're back to the regular work week. So that's the good news. But it's time to be careful and not have big gatherings and let this pandemic and surge with Omicron play out. The good news that we're seeing around the country is Iowa was a little bit later in getting Omicron compared to some of the other parts of the country. In some of those areas that Omicron hit a little bit earlier, they're starting to see a downward trend in their cases. This is a really quick up and down compared to some of the other variants that we've seen. And so if people can hold on for the next 4 to 6 weeks, I think we're going to be in better shape. And so I think there's good news coming. And so hold on just a little bit longer and try and be careful for a little bit. Be a little bit more intentional in your practices, your masking, your kind of avoidance of social gatherings. Hold on for 4 to 6 weeks.
It's great to see that glimmer of hope. Thank you for sharing that great information and advice, things that we can take away with us. So Dr. Winokur, Dr. Diekema, thank you so much for sharing your time and expertise with us today. We so appreciate it.
Thank you for having us.
Yeah.
And thank you to those watching our broadcast today. If you tuned in after we started, the full broadcast will be available soon at the same link. Stay tuned to our social media channels and our website, uihc.org, for all the latest COVID-19 information as we have it. Finally, please get your COVID-19 vaccine and a booster shot, practice safety precautions, and take good care of your physical and mental health. Thank you for watching and have a great day.